All right, Doctor, we're live in New York City again.
Hey guys, it's Dr. Emer, our first live in New York. We've already seen many clients. We're here with one of my previous clients that you guys all wrote in online about because we showed a lot of his strong laser treatment combination of doing hybrid fractional laser, CO2 laser.
We were
plus
criticized on
Bellafill.
lighting.
What'd you say?
We were criticized on lighting too.
Criticized that his lighting wasn't real, that we face-tuned the pictures, but I want you guys to see real time. One treatment, significant improvement. Why do we get that? Because it's the combination. It's not just the laser. It's also the use of Bellafill, which I'm showing you guys today. This is PMMA, polymethyl methacrylate. This product is an acrylic polymer. Yes, it's long-term permanent, but it builds collagen. And when it's done right in a microdroplet fashion, which we're using today in a scaffolding technique.
People are saying, come to Dallas, Texas, please, guys.
We'd love to be there.
We flew over there on the way here. Maybe we'll stop next time.
Exactly. My goal right now is, you can see there's no major indentations, but we know where his scars were previously. There's still some collagen.
Let me show them his before and after. How about that?
Show that. So we are
here's
scaffolding.
the side we're working on right there. You guys see the before is the after. We're doing a little more improvement today.
We're scaffolding the whole area because now it's going to build collagen there, and it's going to keep this elevated and long term give him the support he needs and rebuild the structural damage that had occurred when he had the scarring.
I need to visit your office. I'm in Michigan, not far from here, guys. You want to come see us, send us a DM. Full name, email, phone number. I'll reach out to you.
And so, you know, this is just good showing you guys the building process. My next step with him is going to be do microneedling, radio frequency, and some more lasers, and one more larger laser that he'll do sometime in the next 3 to 6 months. But again, through here, you can still see where there's some level of some scarring. So we just want to go through. And the one thing I do want to tell you, we showed some follow-ups with him being very red. And I think what will be great, Jordan, maybe we post a transition photo.
I will. We'll
next,
show him.
Showing
did have some rosacea as well.
The before, the healing process, and after, because a lot of his healing was bright red because we did a really strong laser. But when you use the skincare products, you stay out of the sun, and you go, you know, you get the right combination, that redness will subside. And those that get a little more red after a CO2 laser tend to build more collagen, which is what I tell people. Just stay calm, go through the healing process.
If you're red,
within the next few months. In the old days, our lasers would sometimes take 3 to 6 months to heal.
Is Bellafill a skin booster?
Well, I'm almost using, a good question, that person's probably out of the United States. I'm using it almost as a skin booster now, but what's different between this and a skin booster? Skin boosters are injected superficially. I'm injecting this really deep. So skin boosters work for hydration. This is not hydrating. This is building collagen and structure.
Do you want to know when we're back in LA? Guys, Dr. Emer's going to Dubai after this. He'll be back after October 3rd. We do have our team there in LA. We have Nisha the PA. We have Dr. Sanin, all of our estheticians. They're still at the office doing treatments. If you're in LA and you need something, we have wonderful staff there for you.
So just so you guys can see, very smooth. Okay, yes, it's a little red now, so we just injected a million times, but very smooth. And when you smile, go ahead and smile. You can see the texture is significantly improved as before. Maybe show them one more time the before and after.
Let's show you guys for our new viewers.
Right,
let's show them.
Perfect.
Check this out, guys. This is before you saw the indentations. Now, pretty much gone.
And then that's it. And then you want to tell them really quickly, I'm going to clean you off. Tell them really quickly what, why you did the treatment and how you feel about the results.
For many years, I had a lot of tone and texture issues with the scarring. And as a result of all these procedures I've done with Dr. Emer, my skin looks phenomenal. I feel super excited about it. And it gives me tremendous confidence that I was kind of lacking before these procedures. I feel like a different person. It's crazy. I can't even put into words like the level of excitement that it gives me. It's amazing. I mean, I was telling Dr. Emer before that like he's Michelangelo. Michelangelo was like the best sculptor, body contour person of his era. That's this guy. He is the Michelangelo of face and body sculpting and contouring, and I mean that with all of my heart.
Well, I went into this because I love helping people. That's So you guys can see little tears coming.
I really mean
That
that.
makes me really happy. I will tell you, we're a very similar age, even though he looks like 10 years younger. I need to start doing these lasers. So Nisha the PA and Rosa, you guys are going to do these lasers, and on me too. Really quickly, should we just do the lips anyways, since we're here?
Yeah.
Why not? So, go ahead. What
I
were
was
you
gonna
going to say?
say, for me, it's hard now because my lips are so numb. But I'm just looking to get some more balance, like more symmetry left, right. And I feel like as I'm getting older, my lips are almost like shrinking almost.
Yeah, I always tell people, think of like a fruit. As it gets dehydrated, the wrinkles, it shrinks in and the wrinkles start to show. The same thing happens with your lips, you lose volume there. The other thing that happens is the mouth bone structure around the mouth caves in. So the mouths tend to cave in and you lose a lot of volume there. So this filler that we're going to use, Volbella, is very light. Doesn't have a lot of structure, it's more soft. I like it for men because I can build it a little bit, but it doesn't look overdone. When you have hair around your mouth, it also makes your mouth look smaller. So having some volume in there and having some shaping with filler is really good. It just has to be done right. I don't like the lips that walk into the room before you do. It never looks good, okay? So we're just going to do subtle enhancement.
Also, like, my mouth almost looks a little bit different when it's clenched versus relaxed, but I don't walk around with a clenched mouth,
Yeah,
so...
you got to do it in movement. So we're going to have you
Okay.
smile and everything. So you guys see he has a nice M shape. We're going to focus on keeping his natural shape. This is a very small amount, very subtle amount of filler. And again, with men, much more conservative. We're not trying to get the Russian lip. We're just trying to get a little bit of hydration.
How is the Bellafill compared to fat grafting to the face?
Well,
Very different.
I did fat grafting for many years. I don't want to give him volume. The idea is not volume. Even though people say nano fat can be injected into the scars, it never looks as good. Bellafill to me is the best. You can see the outcome. He didn't have to have a surgery for it either, just a laser. And then what I want to do, I'm going to come around. Hold on. I'll lay it back a little bit on this side. Back in New York with all the small rooms, but I'm used to it. All right.
You get spoiled in LA with our big office.
Yeah, my rooms are like huge, but it's okay. Just a little bit of structure. Yes, this is a pillar technique.
You're asking, does it hurt, guys? Do you feel a little bit of a pinch with this?
It hurts. Not gonna lie. Back. With men, we don't always create a pillar or a column. We're just trying to shape so it looks more natural. One side's a little bit different than the other. So you can see now it's much more shape. Let's clean them off.
Which brand filler do you use?
Depends. This was Jupiter and Volbella. I think it's a natural look.
Our
When we
office-
do an Emer reveal, give him the phone.
Our office
We'll-
has about everything. Just so you guys know, if you guys are requesting a specific product, we have pretty much everything.
Give him the phone.
All right,
Look at it
I'm gonna
with
turn
the
on
phone.
selfie mode right now.
So take a look with your hand.
Here's the
Just don't
phone. Grab
the
it
phone.
like you're taking a selfie.
So nothing crazy. This is a small amount of
Grab
volume,
it.
but just come in real close to your lips so you can see. And what do you think?
It looks more even.
Yeah, more even, a little bit of
fuller.
shaped, little fuller. I still
And
can't.
it looks natural.
Yeah, and you naturally have like a little indentation here we call it keyhole. I'm not going to change that. I don't like when we give people a sausage lip if they don't have a sausage lip. So we want to create that shaping.
I love it.
So smile, and then rest, and
Yep.
it's natural. Good.
Yeah,
And then
feels
show them in a
awesome.
mirror. Do we have a mirror?
Do we have one of those? Let's see.
Let's see. I like showing it separate because it looks a little different. We do? Okay.
Does
so
this
now what do you
does the
think?
acne scar method work for darker skinned people? They're asking.
Yes,
Yes,
those-
it does.
Now what do you
This
think?
is
This is good, right?
insane.
It looks good.
You are so awesome.
Awesome. This is the great start to New York Day, you guys. Even though it's a little rainy outside, it's going to be an awesome day. So keep following on lives and follow the testimonials because we're getting great results.
You're
Looks
the
so
man.
good.
You
All right, you're
really
set.
are.
You're set for holidays.